Correction is what we do. Correction is what we focus on. Do you have a chronic health issue that you've been struggling with or suffering with? Do you want an answer for it? We don't guess, we test in our clinic. When you test the nervous system, you want to have objective data. As a chiropractor, one of the biggest things I've seen people come in here in my clinic with is that, oh, I got adjusted, and it may have felt better or not, but they never actually said they fixed the underlying issue. And that's because an adjustment is great, but there's a big difference between getting corrected and getting adjusted. So here's the two tests that I would recommend anybody who has a chronic health issue that has not ever had an answer to the cause of that health issue. Number one, you gotta recognize that all health symptoms come from the nervous system. So if you've been dealing with a health issue that's been there for weeks or months or years, just know it's most likely a nerve interference. So how do we test that? Take an X-ray. So in our clinic, what we do is we take an X-ray of the spine to tell us what position your spine is in. It's anatomy physiology. There is a normal position to the spine that you need to have. From the front to the back, it should be straight up and down. From the side, you actually should have curves. All of them should be at 45 degrees. When your spine is in that normal position, there's no pressure from the spine onto the nervous system. And again, your nervous system is how the brain talks to your organs in your body. If we take an X-ray of someone and they have a straight neck, like you see in one of these two pictures, man, it wouldn't shock me if you get migraines. It wouldn't shock me if you get headaches. It wouldn't shock me if you have thyroid issues or something like hypothyroidism or energy issues. It wouldn't shock me if you actually have things like anxiety, depression, or any type of contributed mental health disorder, not because of just your bad spine, but because of what the spine does to the central nervous system. So you have nerves here that are actually, every single one of your nerves are connected to some organ in your body. So instead of, if you have a health issue like high blood pressure or digestive issues, one, instead of suffering with it and just dealing with it, instead of medicating it or covering up the symptom for the rest of your life, understand what's causing it. And you gotta understand how the body works. None of these organs work without the brain healing it, but the brain only can do that by sending messages through that nervous system. So your spine is the protection of that super highway healing power inside of you. Now, how do we test this even deeper in our clinic? Yeah, we'll take X-rays and actually measure it to the millimeter. We then will specifically adjust and do pre-rehab, post-rehab. We give you specific home rehab to correct the spinal misalignments, because that's what we do, spinal correction. But also, we have neurological scans that we will run to tell us what the nerves are actually doing. So if you have a spinal misalignment, we'll run technology like EMG to tell us what those nerves going to your muscles and ligaments are like. Because if we can spot inflammation, boom, there could be your pain right there. There could be abnormal energy or tension in those areas. We also have spinal thermography testing that we use. So if your spine is misaligned, we can actually see if your brain is sending heat or communication to one of your organs. Y'all, you need to get this. Your organs do not have sensory receptors. Most of them are not sensory, okay? You don't feel cancer building in an organ. You don't feel your organ building disease until usually it's too late. What value would it bring if you can run a test to actually see how your organs are functioning well before you got a diagnosis? Or if you do have a diagnosis, let's check to see if it's actually coming from your nervous system. So this objective testing can tell us the root cause of so many different health issues, and then we come up with a game plan. Listen, it might be chiropractic care. It might be spinal rehab that we give you. Usually it's both. Our goal is to help you guys find a cause through testing. We don't guess, we test.